Welcome to Podcast, the Business of Dentistry podcast, brought to you by Practice Plan. Podcast delivers the best business advice, real-life stories, and practical hints and tips to make your practice a more profitable and sustainable business. And now, here's your host.
Hello, my name's Hazel Dockery and this is Practice Plan's podcast, and with me today is Fiona Elwood. She's the Chief Executive of the Society of British Dental Nurses, and we're here to talk about nurses learning to value themselves. Fiona, you've just recently done some work on this. What's the basis of it? What's the crux?
The crux of this is about dental nurses valuing themselves, seeing value in themselves, and just understanding how valuable they are within a team, especially in this current climate where, evidence is showing that they don't feel valued.
What is it about a dental nurse that they don't feel valued,
It's really interesting. So one of the key questions I asked is when you say to somebody, do you not feel valued? And the literature has come back saying one of the top things is not feeling valued is why they would leave the profession.
Right.
And that's why we're looking closer into this, but not the whole reason. But when you ask them, they all say different things. Now, it's whether their voice and opinion's valued, whether they don't feel valued through their salaries that they get or their opportunities they don't get, whether they're not valued by colleagues or whether they're not valued by allied health professionals, for instance. So it's an umbrella term, I think. I think we use it quite broadly, and I think we need to really define that and maybe come together and look at what that means. And then we don't use it in an adverse way, that it's in a negative way really for them.
I mean, that's the negative side of things. Yeah. That's the bad bit.
Yeah.
So how do we flip that on its head?
Well, that's been my sort of excitement of the day, really, particularly as I'm at the dentistry show. But, this is going far beyond that. And I'm really delighted that you've asked me to talk about this because this is a new driver for us. But I've teamed up actually with a health service, and we've been looking at this for quite some time. And this is about being a professional dental nurse advocate. And this is the 4 pillars of advocacy.
Right.
So this talks about restorative clinical practice. We've actually got one of the professors coming in to do a podcast to talk to us about this at council. But this is ultimately about looking at yourself. This is about taking your mirror to you, to building a portfolio of who you are, all the wonderful and exciting things you have done, and celebrating those things. It's so easy to be negative. But this celebration of successes, whatever they look like, and I'm not talking qualifications, because yes, they're wonderful, but they're not for everybody. But it can be charitable, it can be initiatives, it can be campaigns, all the wonderful things, the walks you do to raise money, awareness for one of the cancer charities or whatever. So then it's about mapping the you, the unique you, the mirrored you, to the 4 pillars. And the 4 pillars allow you to look at clinical supervision. Can you do that? Do you do that? Would you do that for somebody else? Education and development. So the development, if education is not for you. Quality improvement. So you can look at self, you can look at others. Yeah. You can help people meet targets of the workplace, if that's what that's all about. And ultimately, it's about that professionalisation of dental nurses and how we can carry that forward. And how wonderful would it be to present a portfolio to somebody and say, this is me, I've taken the time to do this. If you're a treatment coordinator or something like that in the practice, you will have built a portfolio of excellent pictures and all these wonderful treatments that are options. Why not have a portfolio of self?
Yeah.
And almost sell yourself when you go to an interview or a course, or you're trying to convince somebody you're the right person to do this particular thing you want to do. And interesting, in the session that I delivered on this, I asked anybody if anybody had ever done a portfolio of self, if they'd ever stopped and looked and celebrated anything they'd done. Not one person said they had ever looked inwards at themselves.
But doesn't that tell you a lot, really, about the nursing profession and how humble and reluctant to be pushy the members are?
I think it absolutely does, and I think it I don't know whether it comes from, this is part of something else I'm doing, but whether it comes from not being valued and humble, or whether they've actually gone down the path and believe that they don't have value. But without them, clinics wouldn't run smoothly, things wouldn't be set up for patients, they wouldn't be taken down for patients, decontamination wouldn't happen for patients. All the really sort of advanced stuff that they do for clinicians of any type. They're not just dentists, there's dental therapists, dental hygienists, orthodontic therapists, the clinical dental technicians. So, you kind of want to say, well, you don't feel valued. How about you start valuing self?
Have you got any practical suggestions? Because, I mean, it's quite a change in mindset that you're asking for from nurses. And often when someone is asked to do something different and alien to what they're used to, they don't quite know where to start.
Yeah, no, you're absolutely right. And I've faced that with a few things recently. The Society has actually set up a framework which will launch in September, which will help people map to the 4 pillars.
Right.
And they'll be recognised with a fellowship at the end of that if they can map to that. It's not onerous, but it's how it fits into the 4 pillars. And then the hope is that we get this bank of people who will then be whatever they want to be out of those things, whether it's leadership, whether it's a point of contact, whether somebody's willing to go to their place of work and do an observation with them, practicing, and give them clinical support. Because sometimes they don't want to ask the close members of the team or the dentist because they're scared. There's this silly question type thing.
Yeah.
So they want to be able to reach out to other people or have somebody else go in and watch them work. So that is the hope and the drive. But they get the fellowship whether they tap into that or not. So they can either be recognised for the things that they've done, but then they can go off with it, they can run with it, because they will establish themselves, perhaps recognising the value and the skills they actually hold. There's something that I work with in Human Factors, which is called non-technical skills, which works with leadership, management, teamwork, communication skills. And not one dental nurse will recognise those as good skills. And they're absolutely everything they do, they're bread and butter. It's who they are.
But I suppose if you're saying to a dental nurse who's quite often someone who will take direction from someone else, they don't see themselves in a leadership role. They're more sort of like followers in their perception.
What a point to hit on. I'm smiling here because when I did my master's, I did a top-up on leadership and management, and I interviewed dentists and I interviewed dental nurses. And even though the dental nurses were leaders, they were involved at high level in interviews of dentists in a particular service they were in, and they were in charge of the post-willow medical kits, which are really quite a responsibility.
Yeah.
And they were leading in decon. When you ask them directly, do you believe you're a leader, or who's the leader in your team, they said the dentist.
Yeah.
They never actually said, I am.
Yeah.
But interestingly for me, they didn't believe they were leaders, so they hadn't been on a course. But when I spoke to the dentist, and there was a different age range, they actually said they weren't taught leadership skills at university.
Right.
It was assumed that they would have them. And when they walked out of university, many of them were a little bit shocked at how they had to go into a practice and be a team leader.
Yeah.
And they were sort of scrabbling around, if you like, and this assumption that because they were a dentist, they knew how to lead a team. And it's quite often gone wrong. But then when you say, where are the leadership courses for dentistry, there aren't that many either. But interestingly, just before I put my paper in for my last, my thesis actually for my master's, a paper came out which was printed by the BDA, and it was a dentist who'd written it. And it actually said that dentists didn't make good leaders. Now, most people will go, how dare you say that? But the reality is that the dentist was right in saying it, because the role that the dentist plays as a lead clinician, who's the diagnostic individual in it all, they're telling, and it's not the same relationship as leading and leadership. So it's not that they don't make good leaders before everybody sort of says, that's a lot of rubbish, I'm not pleased with this. It's the reality of what they have to do in their role as in the team that doesn't lend itself. They're more managing the situation than the leadership, and sometimes there's a crossover.
Yeah, I mean, you're encouraging dental nurses to build up this portfolio and to tap into the framework when it's available. How are you going to sell it to employers? So practice owners as something that they should consider as a thing of value?
I think key for us in our mindset is, I know there's a lot of talk about retention. It's not something that I spend a lot of time on, actually, all the society. We look at working environments and having great places to work with great people, because if that was solved, we wouldn't be worrying about retention.
True.
So we would be looking at this portfolio of trying to work with employers to actually gain the fellowship, to demonstrate the skills, therefore showing their worth and encouraging them, because if people want to be valued, they need to be able to do something to demonstrate that, and it will elevate their perception of self. So for us, and the clinicians that we've talked to already, it's a no-brainer, because you're actually starting to keep that person. The biggest travesty we have is year on year, the majority of the people we lose are experienced dental nurses.
Yeah.
And if we lose experience, we can't pass good skills on.
No.
So, we've got to fill these gaps somewhere. We've got to stop this sort of leaky pipeline of expert dental nurses leaving.
Yeah. So it's in an employer's interest, really, to buy into it and to encourage colleagues to take part in it.
Yeah, and absolutely. And the thing with dental nursing too is they talk prolifically about career opportunities rather than progression. I think our language is quite damaging to our nurses if we don't get that right either, because we fill them full of false hopes and ambitions, whereas if we're honest and we talk about career opportunities, dental nurses can do so many different things depending on the environment they're in. But we need to be really mindful that many of them in the high street practice can't do anything to get a different status, if you like, a different level. Sometimes they are paid depending on the need of the business need, for different skills and different qualifications. But majority of people say, well, they can become practice managers, they can become TCOs, they can become dental hygienists. That's not a dental nurse.
No, it's something
You're
else.
moving them away from the thing that they love. My ambition is not for people to collect qualifications, but it's for those people who want to be the best they can be at the job that they love, that come to work at 9 and need to go home on time for families because they're balancing sometimes family lives. We need to celebrate those people and keep them, not lose them because we don't fit the model.
And you believe this will help do that?
Yeah. At least get us on the right footing, and it'll open people's eyes and start to challenge and question. Already from the session that I've delivered on this, people are saying, wow, I've never looked at me, I didn't believe I was any good at anything. How can we have that? I don't want to hear those conversations. I don't think anybody does.
No, nobody does. No. Well, I hope that they reduce, once the framework has been launched and people pick up on it.
Yeah, I hope so too. Brilliant.
Thank you very much for your time.